Hello everyone, I'm Dr. Shehnaz at Precious Fertility and IVF Center, Tejpur. So today we'll talking about what are the factors which affect the success rate of IVF. We know in IVF, we get 50% of genetic material and of the embryo from the mother and 50% is from the father, that is from the sperm. So together, if the quality of the egg and the quality of the sperm is good, together they will end up in a good or a healthy embryo which can implant or which has a higher implantation potential. So number one factor which affects IVF success is egg quality. Second is the sperm quality. What are the factors which will affect the egg quality? Like women who have PCOS, who have endometriosis, untreated diabetes mellitus, prolonged hypothyroidism, she's on certain medications. So these things can have a negative impact on the egg quality. Second is regarding the partner, if the sperm is exposed to prolonged chronic infections, okay, or in case of there is hydrocele or any other varicocele. So these kind of things which can increase the oxidative stress within the sperm, so that can have an impact on the sperm quality. Other lifestyle factors like chronic alcoholism, smoking, stress, these are the factors which really have an impact on the gametes. So together, provided that the egg quality is good and the sperm quality is good, it will lead to a healthy embryo which will lead to implantation. Now the second most important factor which determines the success rate in IVF is the endometrial lining. Endometrial thickness is measured on ultrasound. We measure it once we start the FET cycles. We put her on medications and then we measure the uterine lining. Also, we look at the vascularity. The third thing which affects is the receptivity. Receptivity is nothing but there are certain proteins at the molecular level. So, মানে একদম microscopic level যোনটো চকুৰে দেখা নাপায় আল্ট্ৰাসাউণ্ডটো, এইটোৱে কি হয় যে কিছুমান proteins থাকে যিবোৰ এন্ডোমেট্ৰিয়ামত বাঢ়ি যায়, যিহৰ কাৰণে এমব্ৰিঅটোক হি ধৰি ৰাখে. So, receptivity proteins also matter along with the thickness and the vascularity. Also, certain other factors, suppose that the patient has ফাইব্ৰইড আছে, কিবা টিউমাৰ আছে বোলে, আমি যে হিষ্ট্ৰোস্কপি পঢ়ো, হিষ্ট্ৰোস্কপিৰ ভিতৰত আমি কি চাওঁ, কিবা মাংস বাঢ়িছে নেকি, পলিপ আছে নেকি ভিতৰত, বা কিবা ইনফেকশ্যন আছে নেকি. So these factors all together can have a negative impact on the success rate. So therefore, if you are trying to have a baby and you want to have good success, I would suggest you follow your doctor's advice and please take your injections correct.